What is a contrast agent for a stroke brain scan? Imagine trying to see tiny details inside your brain that are normally hidden. That's where contrast agents come in. They are special dyes used during certain brain scans to make blood vessels and tissues stand out more clearly. When doctors suspect a stroke, they often perform imaging tests like computed tomography or magnetic resonance imaging. These tests help visualize what's happening inside the brain, but sometimes the images need a little extra help to reveal important details. That's when contrast agents are used. In a stroke brain scan, contrast agents are usually injected into a vein, often in the arm. For a computed tomography scan, called a cord angiography, the contrast dye highlights the blood vessels in the brain. This allows doctors to see if there are blockages, narrowing, or abnormal blood vessels that could have caused the stroke. For example, if a blood clot is blocking an artery, the contrast helps visualize that blockage clearly. It also helps identify aneurysms or abnormal blood vessel formations that might lead to bleeding in the brain. Magnetic resonance imaging, or MRI, sometimes uses a different contrast agent called gadolinium. This type of scan provides detailed images of brain tissue and can help detect areas of damage from a stroke. The contrast makes it easier to distinguish between healthy tissue and areas affected by reduced blood flow or bleeding. It can also help identify other neurological conditions that might mimic stroke symptoms. The contrast agents used are generally safe. Most people tolerate them well, but some might experience allergic reactions or kidney issues, especially if they already have kidney problems. Medical teams carefully weigh the risks and benefits before administering these dyes. They monitor patients closely during and after the procedure to ensure safety. In summary, a contrast agent for a stroke brain scan is an injectable dye that enhances the clarity of imaging results. It helps doctors see blood vessels and brain tissue more clearly, leading to more accurate diagnosis and better treatment planning. If you or a loved one need a stroke assessment, your healthcare provider will decide whether a contrast-enhanced scan is appropriate based on your medical history and current condition. Always remember to discuss any concerns or allergies with your medical team before the procedure.